Aches and pains in the shoulder are one of the most annoying pains that you can have, affecting your sleep, activities like driving, or even brushing your hair. One of the most common forms of shoulder pain involves pinching of the tendons at the point of the shoulder, commonly known as shoulder impingement. Hi, I'm Andrew Darcey. I'm a sports physiotherapist from Adelaide in South Australia, and today we're going to look at shoulder impingement, why we get it, and strategies that we use in our physio clinic, Leading Edge Physical Therapy, to help relieve this annoying pain. So let's look at the shoulder. Well, the shoulder joint is complex. Whilst it's really a simple ball and socket joint, the socket that houses the ball is very flat and shallow. And this means that there is not much stability provided by the shape of the socket to house the ball to stop it moving around. So in any movements of the shoulder, particularly when raising the arm, the biggest muscle on the outside of the shoulder, the deltoid, contracts to raise the arm. And in doing so, it wants to force the ball of the socket upwards. What stops the ball moving too far upwards in the socket are an intricate arrangement of small muscles called the rotator cuff, which constantly adjust their tension to pull downwards and to keep the ball centred in the socket. So what causes shoulder impingement? Well, shoulder impingement can occur when there is an imbalance of these two opposing forces, of the upwards pull of the deltoid and the downwards pull of the rotator cuff. And if there's a reduction in the pull from the rotator cuff, the small space that exists above the ball, between the ball and the top of the socket, becomes narrowed. This can cause pain, swelling and bruising of the rotator cuff tendons, or the bursa that sits between the tendons and the top of the socket. This can lead to inflammation of the bursa, known as bursitis, or even damage to the tendons. So what can we do to treat shoulder impingement? Well, the first thing that we need to do when assessing a patient with shoulder impingement is to thoroughly assess the function of their shoulder. Part of this will be to determine if there are any imbalances in these muscles that support the shoulder and that may be contributing to the pain. We'll also look at the flexibility of the muscles around the shoulder, as there are some tight muscles around the back of the shoulder that often force the ball upwards in the socket and contribute to the impingement. Once we've worked out what causes the impingement, the management of shoulder impingement probably has three distinct phases. The first phase that we find is sort of to reduce the pain and swelling. So treatment like in this area can sort of include the application of ice and possibly even anti-inflammatory medication from your GP to help reduce any swelling or inflammation of the structures in this impingement zone. The second phase is to rectify any strength or flexibility imbalances. We generally provide a series of simple home exercises that should help improve the rotator cuff function and to improve the flexibility of any tight muscles that we find. The third and final phase is resumption of activity. So once the pain and the inflammation have settled and the shoulder function's been restored, we'll guide our patients through a safe reintroduction back into their activity, no matter if it's putting clothes on the line or even serving at tennis. So if you have shoulder pain right now, I'd suggest that you avoid any overhead activities, avoid lying on the sore side, perhaps try applying ice for 15 minutes at a time, and then plan to see your GP or your physio for an assessment so that you can work out what's going on in the shoulder and what we can do to try and help it. If the diagnosis that you get is shoulder impingement, be assured that there are plenty of great treatments that can be performed to help your symptoms. And at Leading Edge Physical Therapy, we're more than happy to help you get rid of your shoulder pain. I hope you've enjoyed this short information video. If you found the information useful, we'd really appreciate it if you could like or share this video with your friends so that we can continue producing more informative content for you.